Hi, this is Morgan and I'll be doing my head-to-toe assessment. So first I'm going to begin with inspecting the skin of the upper extremities. So I'm going to be looking for the skin color, I'm looking for symmetry, I'm looking for the any lesions. There are no lesions noted. I'm going to palpate. And the skin is warm, the condition is smooth, condition and texture is smooth. I'm going to be assessing the trigger, and there's no tinting noted, which is a good sign of hydration, and the hair is evenly distributed throughout, and it is bilateral. Now I'm going to assess the lower extremities. I'm looking for the skin color as well and the temperature. I'm looking for any lesions. I'm looking for any masses or nodules. I'm going to palpate. And the skin is warm as well. It is consistent with the upper extremities. The hair is equally distributed. There's no edema, no varicosities noted. And for skin turgor, it is normal. The skin is well hydrated. There is no tinting noted. It is equal bilaterally, and hair is equally distributed, and the skin color is normal and consistent throughout. So now I'm going to assess the nails, and I would do this bilaterally. So I'm assessing the color of the nails. They are pink. They do adhere well to the nail bed. They are soft and firm. There's no ridges or opacities noted. Could you bend your fingers like this, back to back? So I'm assessing for clubbing, and they are normal. There's no signs of clubbing noted. So I'm going to assess the cap refill, and it is less than 3 seconds, which is normal. So now I'm going to assess the head. So the head, it is, I'm looking for size, shape, and symmetry. It is normal cephalic, it is achromatic, it is round, it is symmetric. Upon inspecting the scalp, it appears intact, there's no dandruff noted. I'm going to palpate. Scalp is freely movable. The hair quality is fine, it is soft, it is equally distributed. Palpating the face, the head, scalp. There's no pain or tenderness noted, no masses, no nodules. Going to palpate the sinuses. Any pain?
No.
Then there's no pain or tenderness noted with that as well. Now I'm going to inspect I'm going to inspect the temporal artery, palpating, and it is normal as well. There's no thrills felt, no pulsations, and it is intact. So I'm going to assess the TMJ. Could you clench your jaw for me? Great. Okay. Now, could you open your mouth for me? Like that? Okay, great. There's no crepitus, no clicks, no limitations in movement. So now I'm going to assess cranial nerve 5, which is the trigeminal. So first I'm going to do motor. Again, could you clench your jaw? Release. Jut your jaw forward and move it side to side. There's no limitations in movement. There are no clicks, no crepitus, no pain with the movement. Now I'm going to grab one of my tools, and I'm going to assess for the sensory. Okay, so I'm going to touch different parts of the face, and I'm going to assess for light or hard touch sensation. So close your eyes, and this will be soft, and that'll be sharp. Okay.
Sharp. Light. Sharp. Sharp. Light. Light.
And that is normal. Okay, you can open your eyes. Okay. Now I'm going to assess cranial nerve 7, which is the facial nerve. So this is the facial gymnastics. So can you smile for me? Don't show your mouth, smile, Mom. That's good. Now show your teeth. Can you frown? Could you raise your eyebrows real high? Close your eyes. And keep them shut. Don't let me open them. Great. Could you puff out your cheeks? And could you push your lips? Okay, great. Okay, no Now I'm going to assess the optic nerve, which is cranial nerve 2. So for this one, I would do the Snellen test, the Rosenbaum, and I would do a peripheral vision test. So with the Snellen test, I would have him stand 20 feet away from the chart, and he would read from one eye to the other, and then both eyes, and he would read from the down to the lowest line that he could, and then he would do that bilaterally, and if he had contact lenses or glasses, he would be tested with those as well. So that test, it would be graded with, the best score would be 20 out of 20, which means at 20 feet, he could read down to line 20. Rosenbaum, he would have a card 14 inches in front of his face. He'd read it in the same fashion, moving down to the lowest line possible, left to right, one eye at a time, and then both eyes. That would be 14 out of 14 would be the best score. And then peripheral field, so we're going to do this together. Trying to get a good spot. Okay, so I'm going to take an object and introduce it from the side. So I want you to cover one eye. Cover that one for me. Okay. Okay. So I'm going to raise an object up from the side and down from below, and just tell me when you can see it, okay?
Now. Now. Now.
And I would do that bilaterally. Okay, now I'm going to move on to assessing the cranial nerves 3, 4, and 6, which is trochlear motor, the 3, 4, and 6 is the trochlear, oculomotor, and the abducens. So I'm going to get my pen light and have it in my pocket actually. Okay, so this is going to be the 6-point cardinal gaze. So I want you just to follow this light. Don't move your head, just move your eyes, okay? Perfect. Okay. Now I'm going to assess for the corneal light reflex. Just look straight ahead. And there is, it is positive, meaning that there is a twinkle noted in the eyes. So now I'm going to do the cover-uncover test. So I want you to look with both eyes straight over there at that wall. Take your right hand and cover that eye. And both eyes are still looking over that way, which is normal. And I would do that bilaterally as well. Okay, so now we are going to move on to inspecting the eyes. So I'm going to start with the external features. So the eyebrows, the eyelashes, and the palpebral fissures. So the eyebrows are symmetric. Eyelashes, they are normally distributed. They are equal. Palpebral fissures appear intact and symmetric. There is no lid lag. External features of the eyes, I'm looking at the sclera. It is white. Cornea is clear. Conjunctiva appears to be clear with a pink underline. Keep your eyes open for me. Pink with a clear with a pink underline. Sorry. The irises are green and they are round. They are equal and symmetric. The lids appear to be normal. I'm assessing the position of the globe in the anterior chamber, and they are normal as well. So I'm going to assess the pupils. Could you look straight at me? Okay, and now continue looking at me. So with both, when the pupils are looking at me, both eyes are constricting. Could you look over against that wall for me? Okay, now look at my light. Good. And so that was the convergence, and that is a normal as well. The pupils do dilate and then constrict. So now I'm going to just put on my gloves really quick. I'm going to palpate the lacrimal duct. And it is normal. There is no enlargement noted, no nodules. Is there any tenderness at palpation?
No.
Great. move on to assessing optic nerve 2 once again, and this will be, I'm getting my ophthalmoscope. So first I would be assessing the lens and the red light reflex. With the lights off, I would be assessing the red light reflex, and I would be able to see just a tiny red light in the middle of the eye. But we won't be doing that for now. And the lens, I would expect it to be, I would inspect for clarity, and I would expect it to be clear. So I'm going to look at the optic disc, and I would do that bilaterally. It is round, it is intact, there are distinct margins, and physiologic cup is present. Color is about orange, just yellow. Now I'm going to inspect the retina and the retinal background. I'm just going to look in your eye. Great. Okay. It is pink. There's a normal AV ratio with a slight amount of AV arteriovenous crossing. There is there's like a pink background, and there are no exudate, no hemorrhages. The fovea was present. It was like a white dot in the center of the macula, which was fovea centralis, and the macula was a darker round circle that was present as well. Okay, now I'm going to move on to the ears. So I'm going to inspect the auricle and the mastoid. It is intact. I would inspect this bilaterally. I'm going to be inspecting with my otoscope. I'm going to be looking in the ear canal and the meatus. I'm looking at the tympanic membrane. It is a pearly gray. The canal is intact. There's no drainage noted. The umbo, the malleus, the pars tensa, pars lucida are present and intact. They are normal. Now I'm going to assess cranial nerve number 8, which is the acoustic nerve. I'm going to use the whisper, the Weber, and the Rin test. Could you cover one ear for me? I'm going to whisper something in it. I want you to repeat it back to me.
The sky is blue.
Okay, and I would repeat that on the other side. I'm going to get one of my tools. Okay, with my tuning fork, I'm going to assess the Weber test. So I'm going to place this on your forehead, and I want you to tell me when you can hear it, and it should be equal in both ears, okay?
Yeah.
Is it equal?
Yes.
Good. Okay, now I'm going to assess the Rin test, and I'm going to place it on the mastoid and then in front of the ear canal. Tell me when you can hear it.
No.
When it stops.
No.
And tell me when it stops.
No.
Okay, and so that should be a 2-to-1 ratio, which it was, and that is a normal finding. Now I'm going to move on to the nose. I'm going to inspect it for the shape, the size, symmetry. It appears to be midline. It is normal in size. It is symmetric. I'm inspecting the mucosa, turbinates, and the septum. The septum is not deviated. Mucosa is moist. The turbinates are intact and present. Just grabbing my gloves. Could you close one nostril for me? Breathe in. Good. And then I would do that on the other side, and that assesses for patency. Just going to look at your nose. You going to be paying attention to this?
No.
There's no discharge noted, and no abnormalities with the mucosa or the turbinates. So I'm going to grab something that would be familiar for him to smell, and we're going to pretend that this is some kind of fruity smell. So could you close one nostril for me? This is testing olfactory, the cranial nerve 1. Can you smell it for me? Okay. What does it smell like?
Cherries.
Smells like cherries. Good. So he was able to identify that, and we would do that bilaterally as well, and I would use probably a different scent for the next smell. So now we're going to move on to the lips. So I'm going to, or the mouth, but I'm going to start with the lips. So the lips are appear to be pink. They are intact. There's no ulceration noted. I'm going to assess the buccal mucosa, and it is moist. I'm assessing the gums. Smile for me. It is intact. The teeth appear strong. They are all intact. They are present. I'm inspecting the sublingual mucosa. Open up for me. Great. The Wharton's and Simpson's ducts are present and palpable. They are intact. The hard palate and soft palate is present as well. Could you say ah?
Ah.
The uvula is present, and when he says ah, it does rise and it is midline. Upon assessing cranial nerve number 10 and 9, 10 the vagus, 9 glossopharyngeal, I would, we're not testing that now, but I would be testing for normal swallowing, speaking, and the gag reflex as well. So just say ah one more time for me.
Ah.
And when he says ah, the soft palate does rise as well. Okay, so now we're going to move on. I'm just going to take my gloves off for a quick second. And we're going to move on to assessing the neck. There we go. Okay, so I'm going to start with inspection. It is symmetric. I'm going to palpating the spinal muscles and the vertebral muscles and the vertebrae. Any pain or tenderness there?
No.
Okay. Now we're going to assess range of motion just really quickly. Could you move your head forward and backwards? And turn it left to right. Okay. Can you shrug your shoulders? Good. Now can you turn your head left against my hand? And then against my other hand? Great. So that assessed cranial nerve number 11, which is the spinal accessory. We're just going to back up really quick because I forgot to assess the cranial nerve 12, which is the hypoglossal. So could you stick your tongue out and move it side to side, up and down? Great. So that was the movement of the tongue, which is cranial nerve number 12. So back down to the neck. So we just assessed cranial nerve 11, spinal accessory, and he was able to shrug his shoulders and move his neck. And that also assessed the strength of the sternocleidomastoid. I'm going to palpate the trachea. Upon inspection, it appears to be midline. Is there any pain?
No.
And there's no deviations, and it is midline. Okay, now I'm going to palpate the lymph nodes. I'm going to do pre-post and occipital nodes. Now I'm going to assess the submandibular, submental, and tonsillar nodes. Any pain or tenderness?
No.
Okay. Now I'm going to assess the anterior, superficial, deep, posterior, and supraclavicular nodes. And they are normal. They are not enlarged. No tenderness, no masses noted with that. Okay. Now I'm going to palpate. I'm going to inspect and palpate the carotid before I listen. Palpating the carotid, and I would do this on both sides. It is freely palpable. Now I'm going to listen, listening for any bruise. I'm going to use a bell. When there are no bruise heard, it is normal and equal, and I would listen on both sides. Now I'm going to palpate the thyroid gland. So first, could you swallow for me? Okay, I do see a rise and fall with swallowing. Now I'm just palpating. Could you swallow for me one more time? Great, and it is freely palpable, and I would do that on both sides. Okay, now I am going to move on to our next set of assessments. So could you take your shirt off for me? So we're going to be starting with the lungs. I'm just going to start with inspecting the thorax in that area. Yep, you can go ahead and sit. That would be great. Okay, so at this time I'll just go ahead and scan the room. I'm going going to start with inspecting. I'm going to inspect the anterior thorax. It appears to be equal and symmetric. The skin is consistent throughout. I am looking for the movement with respirations, and it is consistent. There's equal chest wall movement. There's no masses or nodules noted. I'm looking for the pattern with the chest rise and fall, the symmetry. The sternum is midline and the scapula are at an even height. Now I'm going to look at the posterior thorax, and it does appear to be equal and symmetric. Scapula are even height. Sorry, I meant the shoulders were even height in the front. The scapula back here are even and symmetric. There is equal movement with chest rise and fall. It is consistent with the respiratory rate. There's no indication of any difficulty breathing or abnormalities in the breathing pattern with that. No masses or nodules, no irregularities with the skin. Could you just turn that way so you're facing that wall so we can get to your back? I'm going to assess for the chest expansion. So I'm going to assess right here. Could you take a deep, big breath for me? Great, let it out. Okay, and that is normal. My thumbs do move apart when he does take a breath. Now I'm just going to palpate, assessing for any masses, nodules, and in the front. Any tenderness?
No.
There's no abnormalities noted. Now I'm going to assess for tactile firmitus. When you feel my hands like this, say 99.
99, 99, 99, 99, 99, 99.
Great, and that is normal. Now I'm going to percuss the back. Could you bend forward and round your shoulders? Great. I'm just percussing in different quadrants. And resonance is heard throughout. So I'm going to grab my marker, and we're going to assess for the diaphragmatic excursion. So stay rounded for me. All right, I want you to take a big deep breath in and hold it. Great. Okay. Now take a big deep breath in and let it out. And hold the exhale. Stay leaning forward for me. Okay, and I'm just going to measure that. And it is about 3.5 centimeters, which is normal. The normal is 3 to 5. So now I'm going to auscultate. I want you just to breathe normal for me, okay? And I'm going to just be moving left to right and down the lobes. Using the diaphragm of my stethoscope. And there's no adventitious sounds noted, and I'm going to now listen to the anterior thorax. Again, I'm going to be moving side to side and down. Great. And again, no adventitious sounds noted. It is normal. Okay, you can turn again and face me. Now we're going to be moving on to the cardiovascular assessment. I'm going to start with inspection again. I'm inspecting for any lifts, any heaves, any thrusts, and there are none noted. So I'm going to palpate for any murmurs and for the PMI. no murmurs noted. And PMI, it's the left mid-clavicular line, left fifth intercostal space, and it is freely palpable. Now I'm going to start with auscultation. I'm going to first auscultate the aortic area. It's going to be found on the right second intercostal space. There. And I'm going to listen with my bell and my diaphragm. And right here, S2 is greater than S1. Now I'm going to move over and assess the pulmonic area. This is going to be left intercostal space, second intercostal space. And again with my bell. And S2 is greater than S1. Now I'm going to move down one to the third. So this is left third intercostal space. This is called Erb's point. And right here, S1 is equal to S2. Now moving down to the fourth, so left intercostal space, fourth. This is the tricuspid area. And S1 is greater than S2. And then lastly, we'll move over to our apical or our mitral area. So this is the fifth intercostal space. And it's mid-clavicular line. And again with my bell. And S2 is greater than S1. Now I'm going to assess the pulses. So I'm going to assess carotid. I would do that bilaterally. The brachial and the radial bilaterally assess as well. And that is even and strong. I'm going to move on to the popliteal. They are palpable, posterior tibial, and the dorsalis pedis. They're equal, strong, palpable as well. Okay, we're going to move on to the abdomen, so I'm going to move over here to the couch so you can lay down. Okay, so we're going to start with inspecting. I'm going to inspect for color. I'm looking for any vascular patterns. I'm looking for any herniations. I'm looking for any masses or nodules. The umbilicus is midline. It is inverted. There's no ulcerations, no drainage noted. There's no striae noted, no hernias, no abnormalities. So I'm going to start with auscultation. I'm going to assess the vowel sounds in all four quadrants. And I'd be listening for them to be present at a rate of 5 to 35. And they are present in all four quadrants. Now I'm going to assess over my organs, my liver and my spleen, for any friction rub. And there's not one noted. And now I'm going to be listening over my arteries. I'm listening over my femoral, my iliac, my renal. We're actually going to skip the femoral for privacy, but I would listen just below around the groin area. So the renals, I'm going to do this bilaterally. I'm listening for any bruits or hums. The iliac. And I'm listening for over the aortic. And there's no bruits or hums heard. So now I'm going to percuss. I'm going to percuss the abdomen. There's tympany heard, and it is normal. So now I'm going to percuss the spleen. Okay, and it is, there's dullness heard, but not dullness heard beyond the margins. So that tells us the spleen is most likely not enlarged. So now I'm going to percuss over the liver, and then I'm going to just grab my pin and my measuring device here, because we are going to It's just my timer. Now we're going to, we already scanned, so I won't scan again. We're going to measure our liver with percussion. So, going to percuss until dullness. Okay, now I'm going to percuss lower from resonance to dullness. Now I'm going to measure. And it comes out to be just about 8, which is normal. We want it to be anywhere from 5 to 10. So that is normal. Now I'm going to palpate. I'm going to palpate over the spleen. So the spleen most likely won't be palpable, but if this is how I would do it. So I'm going to place one hand underneath his back, and I'm going to palpate with my other side. Could you take a big deep breath? And the spleen is not palpable, which is normal. Now I'm going to palpate the liver. And just rest all your weight on my hand and take a big deep breath. Hold it. And it is freely palpable. There are distinct margins. It is soft. There's no nodules. Now I'm going to palpate over the kidneys. They are palpable. And they are palpable on that side as well. Okay, so now I'm going to move over, and you can put your shirt back on now if you want. So I'm just going to move this one more time. Let's get my camera reset up. So now we're going to need to be moving on to the range of motion. Okay, let's see. So we actually won't need this chart quite yet. Okay, so we're going to start with the cervical. Okay, so we're going to assess for flexion and hyperextension. Move your head forward like me and backwards. Great. Now lateral bending, move your ear to your shoulder, to your other shoulder, and rotation. And now we're going to assess for the strength. Turn your head against my hand. And then other side. Great. Move your head forward and backwards. Great. And so when we turn side to side, that also assesses the strength of the sternocleidomastoid. Perfect. Now we're going to move on to the shoulders. So we're going to do flexion and hyperextension. And back. Abduction and adduction. And back. Now we're going to do internal and external rotation. And back. Great. Okay. Now we're going to do those against my resistance. Assessing the strength. Move your hands forward and backwards. Out. And back in. Great. Now for the elbows, we're going to flex and extend. Back down. Now against my resistance. Up and down. Great. And that assessed the strength there as well. Now we'll move on to the wrist. We're going to do supination and pronation. Great. Okay, now you can go back like this. We're going to do flexion and hyperextension. Great. Now move them up against my resistance and back down. Great, and that assessed for the strength. Now we're going to do radial and ulnar deviation, hands in, and keep your elbows straight. Just turn at the wrist and out. Good. Now we'll move on to the hands. So we'll move the hands up and down. Okay, and try to keep the hands straight. Move the fingers up, fingers down. Perfect. Now move them up against my resistance and down. Great. Okay, now we'll do adduction and abduction. Spread your fingers wide apart and bring them back in. Make a fist. And you squeeze my 2 fingers. Great. Now we'll do opposition. Take your thumb and touch your fingertips and the base of your pinky. Good, and that is normal. Spread your fingers out one more time. Try to close them. Great. Now close your hands. Try to open them. Great. Okay. So now we are going to If you'll just turn around, I'm going to assess the hyperextension of the hip. So bring your leg backwards, forwards, or keep your leg straight, move it backwards, sorry. That is hyperextension. Great. And that is normal. Okay. While you're standing, we can do a few more. So if you want to just walk straight to the window, I'm assessing his gait. Turn out and walk back. Walk heel to toe. Great, and that is normal. Okay. Now, we will have you do some bending. So where this is lateral, back up just a little bit. Thank you. We'll do some lateral bendings. Turn left and right. And rotation, left and right. Great. You want to do some hyperextension, bend back, and flexion. Go bend, touch your toes. I'm assessing for scoliosis, and their spine is bend line. Stand back up. Perfect. You want to lay back down on the couch for me? I'm going to just move the camera one more time. Okay. So we're going to do flexion and extension of the hip. So raise your leg up and back down. Up against my resistance and back down. That assesses the strength. Take your knee and bend it towards your chest and back out. Take your leg, this is abduction and adduction, bend it out and back in, cross your other leg. Great. Now move it out against my resistance and back in. Great. We would do this bilaterally. Internal and external rotation, so kind of take your leg like you're about to cross your leg, take your foot and try to touch your knee, moving your leg out like that, jump to the side. Now do the opposite, take your knee and touch that knee. Good. Okay, we would do that bilaterally as well. So now if you want to bend your knee and just rest it right here, extend your leg out and flex it back in. Great. Now up against my resistance, back down. Perfect. Now we'll move on to the ankles. Dorsiflexion and plantar flexion. Put your feet down like you're on a gas pedal and pull them up towards your nose. Now press down against my hands. Pull them up. Great. You want to rotate your ankle. Great. Now we'll do inversion and eversion. So take your soles and try to turn them inward and then outward. Great. Okay. Now if you want to sit up on the side of the couch, you'll cross your legs like a lady. This assesses the strength of the adductor, abductor, hamstrings, and gluteals. Great. Okay, you can stand back up. We have a few more. So we'll go back to the hands. We've got one more to do. So with the wrist, we'll do the radial and ulnar deviation. So turn in line and then out. Perfect. Okay. So if you want to just take a step closer over there. Perfect. Okay, so we already assessed the gait, the normal gait and the heel to toe. So now we'll do the Romberg's test. So face me. Just close your eyes. I'm assessing for swaying. Okay, and that was a normal sign. Now we're going to test the finger and nose. Put your arms out. Take one finger and touch your nose. Okay. Another finger, touch your nose. Now with your eyes closed, take one finger, touch your nose. Good. And we would do that bilaterally as well. That is normal. Now we will do the rapid hand movement. We're going to do the upper and lower extremities. So we're going to turn our hands forward and backwards like this, as fast as you can. Okay? Perfect. Now we're going to do heel to shin. Same thing, rapid alternating movements. Take your shin, like me, and you're going to take your heel and go up and down your shin. Great, and we would do that bilaterally as well. Okay, so now we are going to assess for stereognosis. I'm going to place a familiar object in your hand with your eyes closed. I want you to identify the object.
Is it a coin?
It is. And I would do that bilaterally with another familiar object. So now I'm going to assess graphesthesia. So I'm going to draw a number in your hand, and I want you to identify the number.
8.
Perfect. Okay. Now I'm going to assess for position sense. So this will be up. That'll be down. That'll be neutral, okay? Close your eyes.
Up. Down.
Great. You want to have a seat really quick? Now we'll test the lower extremities. Keep your eyes closed.
Down.
Perfect. And I would do that on the other side as well. So with you sitting, we'll also do the vibration sense. So I'm going to place this on different joints, and I want you to tell me when you can feel it vibrating. Okay? Close your eyes.
Down.
Okay.
Down.
Okay.
Down.
Good. And I would do that on multiple joints. Now we're going to assess for light, soft touch. So I'm going to place this. This will be soft. That'll be sharp. Okay, close your eyes.
Soft on my arm. Sharp on my arm. Sharp on my knee. Sharp on my shin.
Perfect. And so I would do that in different locations bilaterally. Okay. So now we are going to assess reflexes. Okay. We're going to assess the tricep. So just look over there at that wall. Just relax your arm for me. Now we're going to assess the bicep, the brachioradialis. Great. Okay, just gonna have you relax your leg for me. Great. And count to 3 over there. 1, 2, 3. Great. Now stand up on, you're gonna kneel on this with your ankles hanging off of the chair for us. Okay. And this is the ankle jerk. Great. Okay, so those reflexes are normal and equal throughout. You can have a seat on the chair. Okay, so we went through all the cranial nerves. We went through the cardiovascular, the lung, the abdomen. We did the range of motion, and we did the reflexes. We assessed the skin, the joints, the bones, the muscles, the vision, auditory, mouth, the eyes, nose. So all those assessments, if they were done on one side, we would be doing them bilaterally and comparing them from left to right. Throughout the assessment, there was no abnormalities noted. So that completes our head-to-toe assessment. Thank you very much.